There are two main hormones involved in the regulation of appetite, ghrelin and leptin. Ghrelin is synthesized in the stomach and it provides hunger signals to the hypothalamus feeding center in an area known as the arcuate nucleus. This hormone has an orexigenic role, which means that it increases appetite. Leptin is produced in adipose tissues, and it again acts on the satiety area of the hypothalamus, producing the sensation of feeling full. So ghrelin increases appetite, leptin increases energy expenditure, and the sensation of feeling full. In this video, let me take you through the main neurobiological aspects that play a part in insulin resistance, increased appetite, dyslipidemia, and weight gain. The combined effect leads to appetite dysregulation, decreased energy expenditure, and decreased physical activity. Firstly, let's look at appetite. There are two main hormones involved in the regulation of appetite, ghrelin and leptin. Ghrelin is synthesized in the stomach and it provides hunger signals to the hypothalamus feeding center in an area known as the arcuate nucleus. This hormone has an orexigenic role, which means that it increases appetite. So ghrelin increases appetite. This sensation of increased appetite has to be balanced by the satiety pathway. This satiety pathway is mediated by the hormone leptin. Leptin is produced in adipose tissues, and it again acts on the satiety area of the hypothalamus, producing the sensation of feeling full. And there's another thing that happens, it increases energy expenditure. So ghrelin increases appetite, leptin increases energy expenditure, and the sensation of feeling full. Antipsychotic medications result in the dysregulation of these appetite regulation hormones, which can increase appetite, but they can also enhance the deposition of adipose tissue in non-adipose tissues, such as blood vessels. Now, of course, there are nuances between the different antipsychotic medications. There are agents that have a greater propensity to do it, some of them very low propensity, whilst others moderate propensity. Next, this increased appetite and adipose tissue deposition contributes to insulin resistance. Now, bear in mind that antipsychotics can independently do this, and some patients with schizophrenia may have insulin resistance as a core part of the illness. Insulin resistance further leads to decreased glucose uptake by muscle, increased hepatic glucose production, increased breakdown of fat, lipolysis, leading to increased fatty acid and triglyceride production. Now, all of this as a cascade predisposes the individual to inflammation, diabetes, and dyslipidemia. So to recap, we've looked at the two hormones that regulate appetite. Antipsychotics impact that regulation of appetite. Antipsychotics impact on the regulation of adipose tissue and lipolysis, and they contribute to insulin resistance. This entire cascade moves forward to not only antipsychotic induced weight gain, but the development of metabolic syndrome as well. Finally, antipsychotics also act as serotonergic, adrenergic, histaminergic, and muscarinic antagonists, which overall again add on an extra burden leading to increased lipolysis and reduced glucose uptake leading to hyperglycemia.